Does it feel like medicine has failed you? It's all pills and procedures? Have you seen the overreach in healthcare policy and politics? I want to empower you with the knowledge that you need to make your own best decisions. Welcome to the Underdog RN podcast. Knowledge is power, so empower yourself. Hello. So I do want to say thank you to everybody who's been listening and reaching out to me, sending me messages, just bringing some people hope that they're not alone and crazy for thinking some of the same things that I do and feeling some of the ways I do about the trauma that we experience in healthcare and the kind of bonding that occurs amongst healthcare workers. And I just kind of simply want to say, this is what it's like to come together with people. And I think that in every way, it's a huge part of bringing us all together. I'm probably not the only person doing this. I mean, I know I'm not. There's tons of nurses out there trying to bring other professionals together and, support each other and be realistic about what is going on in healthcare. Like, things are just not the same as they were 20, 30, 40, 50 years ago. And you talk to anyone who's been in medicine long enough and they'll tell you the same thing. However, I find that we are still, we've gone to this direction of, apathy and just fear, feeling intimidated, coerced, pressured, guilted, shamed, all of that. And it's really sad to me because we are the people that are supposed to be instilling hope in those that we provide care to. We're supposed to be their rock and help them, support them, give them what they need in a great time of need. And, if you're not feeling that from your leadership, your administration, your co-workers, that's going to impact your morale and mood. And there's so much that goes into that with looking at patient outcomes and how people are treated. And it's ratios, it's everything. And so I think it's really important that we look at what kind of relationship do we have with patients and with our corporate or just local administration, right? I think that the majority of people go into healthcare to be sacrificial, to help others, to, be there and support people when they need us. Very few people I know go into it for money, and I've kind of touched on this before. It's just not a career path that you typically go into to make, $1 million. Tech is that kind of industry, I feel like, looking at it, and even some places there's not even that. The thing is that that's easily taken advantage of, I see. You see healthcare workers having these relationships with their hospital systems. And frankly, I'm just going to say it, it's an abusive relationship. All right. So first off, let's define that. So an abusive relationship is where there's a sort of control exerted and it's in a negative way. Now, you can break that down and say, well, they have to have control of certain things, attire and professional behavior and attendance. And yes, any business does. But let's look at what makes this such a problem in healthcare, especially big hospital corporations. So you're coming to work and you are basically selling your time and skills for a paycheck, benefits, PTO, healthcare, whatever it is, right? It's a trade, okay? You're trading your time for these things. There's this other element to healthcare, though, where your job satisfaction and morale lies in the kind of care that you are able to provide, right? If you go in to a shift as any kind of healthcare professional and you just meet all the marks, right? Things just go really well. You're able to talk with your patients, spend time with them, get to know them, support them. You have a great day with your coworkers. Like, there's so much more to it that you get from that. But if you go into a shift and you come in and everybody's in a bad mood because the charge nurse on today is terrible and not supportive, and you have 6 patients and 7, 8, 9 patients apiece, everybody's stressed out, everybody's running around, no one can help each other because everyone is equally swamped and drowning, there's a whole other level of impact that has on patient care, as well as on you in your own personal stress and health and job morale, right? I feel like when we look at what an abusive relationship really is, there's a few things that we look for, right? You look for this sense of control over, certain things, communication, the dressing, isolating people from others. There's a coercion of things that, you're forced into, that you have to comply with or do. There's emotional manipulation, and it can even, go up to physical violence. Now, thinking about that, right? Isolation, coercion, emotional manipulation, communications monitoring, physical violence. Any healthcare worker, ask them, do you experience these things? I would say a good majority of them are going to tell you yes. When you think about it, does your boss monitor your social media? I have known people that, not just the whole call-in thing, oh, well, they posted on Facebook, whatever, there's that, right? And that's in any industry. But I mean, we're short-staffed today. I tried to call them, and now I see them posting pictures of this, this, and this. It's your day off. Post pictures or whatever you want to. I had a whole ordeal with my social media back in 21 when I was kind of starting to launch the organization that I did, and was pulled into a conversation about solicitation. There was no proof of anything. There was no, though that there were, messages, whatever, all of this. And I basically was, well, let's see it, where if I'm going to be in trouble for something, you should have evidence of that fact. And, it's just all of that, right? We don't like what you're doing, so you need to know about that. Even if you have no ties to your company whatsoever on your social media. How many times in healthcare do you hear the line, hey, we were just calling, we really need you to come in. We're super short-staffed and your team needs you. You don't want to let your team down. Or everybody's got this many patients, could you come in for just a few hours? The guilt and the shame that comes with it, right? When you call in, if you're legitimately sick and you call in, the amount of shame that you feel like you have a contagious illness, you're going to take care of sick people, and we're going to dock you points, and we're all going to shame you. That's what happens. Not amongst your coworkers necessarily. I don't see a lot of that, because people are like, hey, you're sick. You need to rest and go home. Don't bring that to work. We all don't want it. You don't want to pass it to patients. That just doesn't make sense. But there are people having breakdowns at work, right? Over the stress and the expectations and, just the load of things and the drama and just all of it, right? And you're here in this place for 12 hours. Okay, these are long shifts. This is literally half a day, 3 days a week. So when you do it in a row, it's pretty all-consuming for that whole 3 days. And if you're on nights, it's 4. Because you got to flip-flop your schedule, or you got to sleep the whole next day, either way. When people have those breakdowns, it's seen as this weakness, or it's punishable. again, with the point system. Like, you have to, I get it, you have to keep attendance for things, right? But if someone, a human being, is sitting in front of you having a breakdown because they are too mentally overwhelmed, too emotionally overwhelmed, they've had something personal happen, whatever it is. I mean, you're going to have people that take advantage of any system, but you're going to punish the good, hardworking people by taking away bonuses because they called in twice in a year because their kid was sick and then they got sick one time, or had to have some kind of emergency where they were in the ER or got admitted to the hospital or whatever it is. Like, none of this is excusable, which makes no sense to me working in healthcare. Like, we are just creating this toxic, strict environment where that's not what we're in. Like, this is not factory work, okay? A hospital is not a factory or a mill. Like, you are providing a personalized service to people for their lives, for their health. I mean, you can't take on the whole world's problems, but we also can't sit and put in everybody into this cookie cutter mold and have these insane expectations. And anytime you falter from that, here's your punishment. This is just crazily promoting burnout amongst people, right? You can't request a day off of your scheduled requirements. You have to get coverage. Oh, and if you get coverage, yeah, sure, we'll add you to another day. Excellent, great. But like, what? You make everybody work this if they need it off for some kind of special family event, and you have staff to cover it, and you get plenty of notice, right? Like, if you give a month, 2, 3, 4 months notice, 6 months notice for vacations, whatever. I don't know how many times I've run into this, that people request vacations off. And they're like, well, that's your scheduled weekend, or that's your, you're on a track, or you're on whatever, the set schedule. And it's like, okay, I'm just asking to deviate from that one time, this one day, or this one weekend in the whole year. Oh, well, that'll take you off a track. Or, oh, well, you're just going to have to call in and take the points. What? Are you kidding me? You have an insanely dedicated worker who shows up on time, all the time, is super supportive, has no issues, doesn't ever call in, wants a vacation. Like, I know a nurse who left a position not too long ago because of this. Or your vacation's approved and then they backtrack. Like, how is that even possible? You buy ticket, like, you're not promoting any kind of work-life balance there. And when you have these strong employees and then they see other people getting away with whatever, calling in once a week, calling in once a month, not showing up late all the time, and it's like, well, there's a process. Or creating a completely toxic environment for everybody else to have to deal with, and it falling on deaf ears. What hope are you giving people? What are you doing to encourage them to stay with your company? You're not. You're building this sense of burnout. And frankly, you're creating an abusive relationship amongst frontline staff and administration corporate. And I've been talking to people about this. There's something that happens. I don't know what it is, because I'm not going to lie. I've never been a manager. Never been a manager over people. Right? I've been a charge nurse, never been a manager. There's something that happens when people transition into these roles. And I think I've mentioned this in previous episodes. If someone can explain this to me, that would be great. Because it's like people who are really passionate, that you really trust, that you see is going to be great. It's like they just lose all sense of that. Well, what party can we throw? What would you guys like? An ice cream party? A pizza party? Let's do t-shirts. No, I want support. I want real, tangible things in my day-to-day work life. And when I ask for one Sunday or one weekend or whatever it is off, I can get that. Right? If I'm showing up, if I'm working hard, if I'm a great staff member, like, why deviating one time does that not work? And now you can get into this whole, well, special expectations, and if we make a thing, what? Why not have that in your policy? There was track or schedule. Basically, it was a scheduled, it was a set scheduling process, right? And if you want to deviate from that, like, give people that flexibility once, twice a year, maybe. I mean, that's it. Like, you don't have to, the whole point is that it's a set schedule, but people still have lives, and unless every single person in your whole household runs on the same schedule, it's not going to, like, you're going to need some flexibility there, right? Controlling everything from your hair, like, you have to buy these scrubs from this store that have our logo and only these. Now, there's policy and then there's enforcement. But when you do that, when you don't enforce all your policies, you look ridiculous. And then it makes people question, well, are they really going to enforce this one? Well, what's the flexibility to this policy? Like, you're setting a whole tone, right, for this underlying flexibility or lack of seriousness, dedication, whatever you want to call it, to your own policies and procedures. Well, they don't enforce this policy, so maybe they won't enforce this one. Or, what really are the consequences of that? This is something my troublemaker brain, I guess you could call it, has really started questioning, right? Like, first question I ask anybody, is there a policy for that? Okay, what's the policy say? Okay, what's the actual fallout for not following that policy? Like, I mean, I hate to be that way, but when you look at, that's how you have to be, frankly. Like, a lot of the time, you have to ask those kinds of questions. I mean, nurses are professionals, okay? And as I've said, like, nursing is my heart. It's where I'm at. It's what I love. It's what I focus on. But any profession, really, right? You do have to have certain markers, okay? There's certain lines, like the clothing. All right. Yes. Okay. Scrubs. It's practical, pockets, it's more uniform. And I get all that, right? You can't show up in high heels and a mini skirt, with a crop top and 3-inch long nails and expect to be able to provide, effective, appropriate patient care. It just wouldn't be professional. I wouldn't want somebody like that working in my company or coming to my hospital to work, right? But I think that we've taken some of this to just ridiculous proportions. So why are we looking at all of this, and what is happening from middle management up? How are we so disconnected on the front line to the middle management tiers, to the ivory tower, corporate, whatever it is, leadership? And then nobody's going to hand us rights on the front lines, right? They're not going to come down and be like, we really want to know, we want you to have a safe advocate to, ask questions of and do all this. Like, this is something I've been hearing about from a lot of different places actually right now. There's a lot of interest kind of across the board in chats and groups and everything online, all this stuff about unionizing, right? And I think a lot of the nurses unions are really getting out there with some stuff like to teach people and help people build these. So, and I think healthcare workers are getting fed up enough to actually start taking steps to do this kind of thing. Right? Like I remember my first experience asking about a union, and I was sitting at this break room table and I'm like, why don't people just unionize? Like everybody feels like they don't have a voice and they need representation and they need, this ability to, push back and make demands and have their voices heard. And hey, this is the, standards that we're going to set. This is what our expectations are from you as a company. And this is what we will offer you in return. And everybody just looked at me like I was crazy, and then looked around, made sure nobody else was there, and said, you get fired for that kind of talk. And then they all started talking about a few people they knew that got fired for those kinds of things, for talking about this or encouraging that kind of thought and process. And I'm like, well, so when you look at it, right, the anti-union kind of movement is, well, you're going to be paying union dues and that's just going to take from your wages, which is going to cost you raises from us. Well, you're not really going to have a voice in it. It'll be the union that talks for you. Oh, it's going to make it much harder to get rid of bad nurses or healthcare workers because they're in the union. Well, frankly, for those of you out there who, how does that seem any different from what we're in now? I mean, do you feel like you have a voice? If you do, I'd really love to know where you work and how they structure things. Do you see that it's difficult to get rid of people that don't hold up their end of the deal when it comes to working or showing up or any of that? Like, I have seen some really ridiculous things go down in the 7 years that I've been at the bedside. Like, just the kind of people that are hired, the kind of people that are kept, the transitioning of positions rather than, being like, hey, look, this is unsafe. We have done everything. Like, I've seen everything from a new nurse go through a dozen preceptors, even pulled from other units, still doing dangerous things and unsafe things, and just getting moved to a different, less acute, lower risk department. And I'm like, why? Like, this person is unteachable. They are refusing to hear any kind of feedback. You've had a dozen different personalities try to work with them, teach them anything. Like, this person does not need to be in a healthcare setting, or they need a serious, intervention about what they're doing and about how they're practicing and their mentality behind it. I've seen people that call in all the time. I had a nurse one time in a unit. She literally called in once a week. And she was there for months and months and months and months. That makes no sense. And there's the stuff like in any business where, you know somebody who knows somebody and things get swept under the rug and whatever, and everybody knows about it and everybody's upset about it, but nobody can do anything about it, and they take it up the chain, and eventually, hopefully, something happens. I've seen it where it doesn't, and I've seen it where it does. So there's a solution, right? Unionizing. Now, that's going to take some serious effort. You are going to have people that kind of lead the effort, and it's going to be putting your name out there, right? If you're going to be the one trying to have conversations with people. And you also have this, push for right to work. That was a big thing a while back. I live in a right to work state. The thing with that is, though, like, looking at it, they talk about, the unions, they talk about, well, this is how they're weakening unions. And what it does basically is it gives people the opportunity to not pay union dues. Okay. So here's the thing about that. That's a double-edged sword. So yes, does it weaken the unions because people can be in the union and not pay dues? Absolutely. However, there's also the accountability to unions where it strengthens the members by, if you have someone in power who's ineffective, they're in the company's pocket, that they're not standing up for what you need, or they're not handling the financials appropriately, because I've seen this personally where you're supposed to have this like war chest where if you go on strike and, so it'll cover your wages and stuff like that. And it just never was done. Like, it was just, they never set that money aside like they were supposed to. It was handled very poorly. You have somebody like that who's not handling things properly. Well, we're just not going to pay our dues until this person is taken out of this position. We want new elected members. Right? This would take a very strong, coordinated effort. People are going to have to be committed, and ultimately, I think that can happen because everybody wants the same thing. Even the people that are not in healthcare for the personal patient connection and commitment, that, are burned out, really are just, they're on the verge of retirement and they want to finish it. Like, everybody wants to come in, do their work, have an opportunity to get their work done, well, have satisfaction in that, and be supported while they're doing it. Everybody wants a good wage, support, fair benefits and scheduling, things like that, like things that are just important to having this work-life balance everybody preaches about. So even the people that are like, I don't even want time to bond with my patients necessarily. I just want to be able to come in and get my work done and not walk into this, ridiculousness of, well, we're going to add this charting. Well, we're going to check these things. Well, we're going to audit that. We're going to take this away. You have 7 patients, 6 patients. You're doing total patient care on this many patients, whatever. Okay. The thing is the people that organize this, you're going to have to be able to speak, right? You're going to have to be able to speak and communicate effectively amongst your coworkers. You're going to have an underlying level of trust amongst your coworkers, because it's going to be, everybody's got to put their money where their mouth is, right? You're going to need legal representation. You're going to have to spend time deliberating these things and coming forward to the leadership and saying, hey, look, here's the deal. This is what we want. This is what works. And then you got to trust this person to negotiate with the company for what you guys ultimately demand, on top of also making sure that the company is agreeable to all this, right? Because that's what it's going to take. I think that it absolutely can be done. And I know I'm hearing this a lot more from people from all different kinds of healthcare systems, and I think that there's going to be a big push for it before too much longer. Like, people are tired of not having a voice. And the people that are skittish about it or don't want to put their name on it, like, there's a few questions you can pose to them. Where are you going right now? Like, is this what you want to do forever? What about 5 years from now? Like, do you want to stay complacent in being voiceless, stressed out, and then have even more demands on your time? Because they're not taking stuff away, right? Like, they don't come to you and be like, hey, so we hired this other person so that you don't have this responsibility. You don't see that, right? It's maximize that bottom line. Let's do virtual education only. Let's do, let's have these people take this load of patients, this team. And I mean, just all of it, right? It's stretching everything as thin as possible to make the most money. And places are still going bankrupt. Imagine that with this mentality. Okay, I know there was a physicians group that just went bankrupt. And one of the CRNAs that I've known, it just completely fell apart. Like, what do you do, right? After you've put all this commitment in and different things that they've paid for or done for you, and, or that were part of your agreement, and like, where does that all go? Just poof? Like, how does that even work? There's also the route of supporting these independent, outside of the system places, right? Like, the wellness company is one I know. It's a telehealth supplements line. They do multiple things, and they have, ideas. They have a book. It's super cheap on Kindle. One of the doctors is here in Missouri. She's fantastic. Then they're working on, building this alternative system. You have the DPCs, like direct primary cares. If you don't know about those, look that up, because this is the alternative to insurance and all of the other craziness in the system. Something else that I have seen is people starting their own stuff, right? Like, you have a set of skills. People need and want those skills, even hospitals or whatever. Be your own contractor, be your own person. Like, that kind of a thing is coming around as well. And I think there's some intimidation to that, or find someone that is doing it and work for them, work for, an individual, which has its ups and downs as well, but find somebody you trust and start something of your own. I would really love to see a healthcare worker bill of rights, like an applicable, practical healthcare worker bill of rights, even at a state level. I think that would have, tremendous power in it. Now, it's got to hold some weight. Okay. Because we have a whole lot of legislation that's not worth the paper that it's written on. Okay. It's got to hold some weight. Like, what are the consequences for not? If somebody files claims against this, and there's whole processes to be built in this, and who do you report it to, and who follows up, and how do you keep the regulatory bodies and the, CMS and the state, all that stuff. You're not going to keep everybody out of it, right? But you have to have independent places where these things are reported, just like a compliance line. If you don't know about a compliance line, you need to learn about it. Like, it's something you use. And frankly, I've had to use one in the past because of situations that were happening on my unit, and report things. And you can do it anonymously, and then they give you a case number, and then you can call back. They don't take your name, your nothing. And it's an independent company from the hospital. Nobody ever knows. Nobody ever knew that I said or did anything, but something had to be done about what was happening. And so if you don't know about that, you should definitely use it. You just call back in with the same case number, and then they give you an update about what was and everything I reported, it was found to be true because there was evidence in a paper trail and all of this, and it was dealt with. Like, you didn't see it happening anymore, So for something like this, though, there's definitely quite the lobbying power against it, right? Hospitals, the AMA, I can't say whether or not they would support something like that. They put on this front of, being for physicians and healthcare and all this. And, it's very interesting to me, though, that when you look and pull their financials, where a lot of their funding and stuff, their money comes from. And, I don't know if a lot of people know this, but the AMA has copyright on the CPT coding system, right? You talk about coding and billing, and you hear all this all the time. It's got to be put under the right code or right diagnosis or, whatever, blah, blah, when they get admitted. You hear it in all settings, okay? Because otherwise you don't get paid. So they have copyright over that. So they get royalties on that. That is the universal system that we use, that all systems use, including Medicare, for our medical billing practices. Insurance companies, electronic health records, hospitals, CMS, everybody uses this. It's like a monopoly in the coding billing system. And then of course you have revised versions. You have all the education and training and certifications and books and everything that comes with that. I'm reading more into this, and that's for a later time. So when you're talking about rights for healthcare workers, now you might be one of those people that's like, private businesses can do whatever they want. Sure. I have no problems with that. When you're a private business, you open up a coffee shop, right? People pay you for your coffee, and you do with what you want with that money. You either put it back into your company, you pay wages, insurance, whatever, or you go out and gamble all of it. Bad or good business decisions, that's on you. However, when Medicare is taking money out of every single working American's check in the entire country, and then you turn around as a hospital and accept that money, are you really private? Right? Are you really private pay? If you accept money from the state that is funded by taxes, are you still a private organization? We have become too complacent in paying taxes and getting no say-so in the spending of that money. I've seen ridiculous things brought before different committees at the federal level of investigating whale sperm or, I don't even know, earwax of whatever animal. I don't know. It's a lot of ridiculousness, frankly. What's here is broken so badly. Medical errors are the third leading cause of death, but we're focused on, well, let's just keep doing this. Well, let's go spend billions of dollars into researching this and that and da-da-da-da. We can't even get our practice down right or safely. And unless you're one of these people that has an excellent CPA, you're just going to get back whoever you go to says, oh, yep, this is what you qualify for. There is hope, though. Like, there is hope, just by listening to this, like educating yourself. I listen to all kinds of different podcasts. I was turned on to Sawbones lately, Jordan Peterson, Joe Rogan. I don't know. There's a whole list of them that I just kind of flip through, and there's different nurses I watch on YouTube Shorts and stuff like that. I really try not to spend a whole lot of time on my phone, so I do like audiobooks or podcasts and kind of things. But just like opening your eyes and seeing what's really happening. So like the CMS thing, right? CMS takes money from everybody. Then you turn around, AMA has all these, the CPT coding billing system, right? And I'm still trying to find how much CMS pays them for that, or how all of that works. I want to break that down. And then the AMA spends a ridiculous amount of money on lobbying. And why do you think they do that? So they spend money on lobbying for what? Right? If it's on physicians, then why are so many physicians unhappy and out of control in their care? Why do we have all these ridiculous healthcare things, like different systems, affordable care, all this stuff that's not working? Okay, if you're spending this ridiculous amount of money, where? So that's the next thing that I'm going to pull. Like, it's all where politicians get their money, or a lot of their like donations and all that. Now, I'm sure there's a whole bunch of other stuff we don't get to see, but you can pull up funding. Like, you can pull up the individual PACs and things like that, see where money came in, where money went out, who it went to, how much, all of that stuff. So that's something I want to keep. I'm reading through the 22 AMA's financial report. It's pretty revealing, actually, for where they're funded. It's not, you'd think members, that's not the biggest chunk of it. I think that, having support in numbers is super powerful. I have seen it firsthand. It's a lot of time commitment for the leadership, and there is time commitment for the people involved. But like, whether it's time, money, skills, whatever it is that you can do, bring everybody together, and change can be made. I will never forget this man that reached out to me, asked me to write a petition, and I'm like, I'm a nurse. I don't know what goes into a petition to make it effective. So I did my best, right? He was trying to stop a mandate at his company. He's like, I know it's coming. There's just these under grumblings going on, and we're not going to have it. Like, there's a bunch of us that don't want to have it, and we don't know what to do. So what would you recommend? And I'm like, I didn't stop the mandate where I was at because I didn't even see it coming, like a lot of people did. And I'm like, that just doesn't, flow with the science. But I'm not Fauci, so I don't get to make that up. The point is, I wrote this petition, very basic, just like, we do not support a vaccine mandate, that if a COVID vaccine mandate is instilled, we are prepared to walk day of, basically to find down that we don't approve of the sharing of our personal health information with anyone outside of, essential healthcare personnel, like the nurse that does physicals, things like that, or workman's comp cases, and that's only whatever is required. Because you had all this stuff happening where lists were sent out, and this is still happening, where lists are sent out to the managers, supervisors, whoever, of people who didn't get this, didn't get that, right? So your manager knows that you didn't get the flu vaccine or the COVID vaccine or whatever, right? Or you have to have this, that, or that done. Like, how this doesn't fall under HIPAA, I'll never understand. Because I feel like that is a health department in your company, nurse in your company, whoever, like, that would be the only person I could see it being okay to share that with. But instead, it was with managers, supervisors, directors, and then coworkers. Like, so-and-so didn't do this, so-and-so didn't do that. They got to get this still, or they got to get that. I mean, I saw so many people where their coworkers were like, well, just do it. Just do it because it'll be fine. And we want to keep you. We miss you. We love you. We hate to lose you. Like, what? Why do you even know? How do you even know? I was very loud about my, personal opinion, but not everybody was like that. There were a bunch of people that are like, I don't really know. And, I'm not sure. Or some people that didn't tell anyone, they're like, I told nobody. So my manager got it and then shared it with people who then shared it with other people and everybody knew. How is that okay? Like, HIPAA, but not for you. Your health, just whatever. Who cares? Nobody cares. That's not okay. That's not okay. We have got to stand up together. Whatever that looks like, whether it's banding together and unionizing, or, that's basically what you're doing, right? Like if you protest, if you band together and come up with demands, whatever, like you need to have an official kind of backing there. Like you need to do it in the right way, whether it's, petitioning, anything like that. I know people that are fans of unions and not. I think that if you have the right personnel, that's what's key, right? You have to have somebody who's going to be a good leader that you trust, that's going to do the right thing above all else. That's what's most important there. I think that looking at like, I don't have the money to do this. I don't have the time to do this. Like, okay, well, what can you do? Can you show up to a meeting? Can you sign a petition, virtually or in person? Can they bring it to you? Are you good at organizing people? I was never more grateful for the lady that built the website that we used when we were doing all of that, and that was her contribution, and it was amazing, because that was a steep learning curve for me. That's not something I've ever done or been interested in. The whole point is like, you are not alone. And, you got to go out on a limb a little bit sometimes to talk to the people around you. Like, I would really love to set up a place for people to go and talk online that's not as monitored, that's not accessible to your administration, whatever it is. And, just really... And then see kind of the area that you're in, right? Like even the state, city, whatever, however much detail, and then find people around you, because we had numerous people that would join. We have a healthcare workers group. I think it's like 500 something people at this point. But it was healthcare workers only. And we had to verify like, this is what you do and whatever, and talk to people and stuff. But like, they'd be like, oh, I saw this other nurse, or I saw this other OT or RT or pharmacist or whoever in here, and I had no idea. And then we met at work, and, like just the support that you have. Like, you're not alone. Okay. You are not alone. You can find common ground in something with just about everybody. Even people that are completely on a far side of the fence opposite of you, you can find common ground with them. So know that you're not alone. Change is coming. You don't have to be able to offer money or time. One thing. Find that thing that you can give, and then find somebody who's doing something in that realm of what you're passionate about. Because when you're passionate about it, you'll be committed to it. And then support that person. If you can't lead something yourself, support the people that are. That's what's important here. That's what's gaining momentum in the school systems. That's what had momentum with the healthcare stuff before. You see all of this, right? It's just support. That's huge. Whatever you can do. The man I helped, it was one man, and I think like 100 signatures in a huge company. But the amount of money that would have cost to have operations shut down, like that, if you have that, right? And this guy's been at this for maybe a week. Okay. It's not going to be well accepted. And they know that. They don't want you to have power. Okay. So you've got to stand up for yourself. You've got to be willing to commit to some of that yourself. Whatever it may be. I'm so glad to hear from everybody. Please continue to reach out, message me, email me. However is easiest for you. If you have questions or support, don't forget to share this. I want to reach as many people as I can and help with whatever I can. I want to bring knowledge to people and just empower you. You can't just, at the bedside, you're not taught a lot of this stuff. I was not. All of this has been learned over time in my own independent research and reading and looking things up and figuring out stuff. You're not taught business or insurance or any of that stuff as a nurse. you know? A lot of healthcare professionals are not. And so we've got to do something about it, and we're going to have to educate ourselves along the way. It's going to be a team effort, but I know we can do it. So thank you so much for listening. Let me know if there's anything that you know or are interested in hearing about, or kind of if you're looking at things kind of in this line and you have a perspective, like, I would love that. I hope that you guys have a great week. Thank you for tuning in today. I hope that you found some of the information insightful and helps you advocate for your own care or someone else's. I want to encourage you to follow me on Twitter, Rumble, YouTube, Telegram. You can also find me at my website, underdogrn.com. Knowledge is power, so empower yourself, and let's make it make sense.